I was asked to give an update on our emerging diseases response plan. And last year at Forum, the delegate body had asked us to put together a response plan, also a look at what was out there as far as a risk assessment or threat, looking at threats that were out there for emerging diseases, as well as issues on how we could, or ideas on how we could strengthen our borders. So this is the response plan, and as you can tell, last year at the Forum, we were in the midst of trying to deal with PED and the mess that we were having with PED, and a lot of the discussion was around what could we have done better, were we ready, who did what, who was supposed to have done what, and where were we going from here. So out of the resolution was a swine diseases matrix that is being taken over and that project has been conducted by the American Associations and Swine Veterinarians, identified about 48 different viruses worldwide that we don't have here, that we don't want to have here, and some of the characteristics around them. We'll be talking here about the Emerging Diseases Response Plan, as well as we did a Strengthening the Borders project. We basically did part one, which was identifying a lot of the items that come into the United States, from where they're coming, how much is coming in, and who inspects and who controls those products. And then I'm going to touch a little bit on the fact that as we were doing all of that, USDA was also looking at developing their own reporting and response plans that we're having to work with and trying to get those to be a cohesive idea. So, I think that one of the things we wanted to make sure is that we didn't fit Einstein's definition of insanity and just keep doing the same thing over and over again and expecting a different result. So what we learned from PED and what we've probably learned to a lesser extent from some other issues was that we needed a consistent communication and a consistent route of communication. So we needed to be able to pick up the phone, know who to call, what those people we were calling, what their authorities and responsibilities were. We needed to know that if we talked to them, that we were going to hear the same story, then somebody else was going to be talking to them. And we needed to really have a consistent way to communicate with the industry, with the states, and with the federal government, and then as well as our diagnostic labs and others. We needed to understand the authorities. In May of 2013, when we first had PED, a lot of the concern about what we were going to do, how we were going to do it, some of that was confused by, did the federal government and various state governments have authorities to take actions around farms that had PED, because it was not a foreign animal disease as far as related to the World Animal Health Association. We needed to look at tools and resources. Did we have vaccine? Was there diagnostic tests? What were our resources to talk to producers? What were our resources to investigate where it came from? So all of those tools and resources, we didn't have identified where they were, who was in charge of them, what our capabilities were, and we didn't have a central entity to coordinate those efforts. So there was no one entity that just said, hey, I got it. We'll get everybody organized. I'll send out people to do various things, and we'll take care of this. There was no one central entity. Now, we worked really hard to develop our strategic groups. We've had a lot of lessons learned from that, but in May of 2013, we did not have that. So we were tasked with developing an emerging diseases response plan, and that plan was put together by a group of producers, state animal health officials, and federal veterinarians from USDA. And we picked the group, it was a big group, but we wanted to make sure that we had producers from different geographical areas, anywhere from the Panhandle up through Minnesota, out to the Carolinas. And we also wanted people that were with big systems, as well as independent farmers and veterinarians that served independent producers as well as system veterinarians. So we really tried to get all the different production types, the different geographical areas. Even our state veterinarians, we had the state veterinarian from here in Texas on the group, who has a very different type of production than the state veterinarian from Indiana that was the other state veterinarian on the group. So we really worked hard to make sure we got a look at the whole industry. And then what we came back to, we said, what have we done right in the past? And we looked back and said, pseudorabies was an area that when the U.S. pork industry decided they want to get rid of pseudorabies, they put some processes in place, they banded together, they had good communication, and we were able to eradicate pseudorabies in about 10 years. I mean, we had tools, we had vaccine, we had diagnostics, but we also had a plan and we knew how to put it together. And part of that plan, and unless you were like Don Buell and going to NIA or LCI meetings at that time and knew what a control board was, a lot of you eradicated pseudorabies from your farms but didn't know that there was a control board behind you saying, here is how we are going to determine how a state is categorized, whether they're free, whether they're stage 1 all the way up through stage 4. They didn't see that there was a strong industry, state, and federal board that was actually working to implement that response plan. And it had no authority, wasn't funded by anybody. It served at the will of the industry, and the state and federal authorities that were on it were on it to serve industry and use their authorities as they could for the good of industry. So we broke down the steps of a response in this emerging diseases response plan, and we looked at the fact that first of all, you have to identify that emerging disease, and we can look out in the rest of the world. Let's say right now we know there's a really hot strain of pseudorabies in China, so we might want to be ready and have a response plan, a thought of a response for that already. Or we could look at what we did with PD, where we've got something that pops up in the U.S. and we have to be prepared to identify and then suggest a response. One of the things that we feel is very important is to have rapid response teams. So have trained state, federal, industry people that can go out and identify, look at a site. If we're talking PED, they may have gone to Indiana, they may have gone to Iowa, to some of those first farms, tried to understand the scope of the outbreak, understand more about where we might have risk factors, and really go out and gather information. And then that information can be used to actually bring back into that control board type structure for them to build suggested responses off of. Ought to look at other sources of information, and go back to the PED example. As we were looking at what was going on in the U.S., we were also calling around going, what do we know about what happened in China? Are Korean scientists available to us to help us answer some of those questions? And then with all of those sources of information, we would view this board as having their responsibility would be to gather that information, look at the information, and recommend what a response should be. Because they have no authorities, they're not going to be the party that actually responds, but they're going to recommend to various other entities what a response should be. And then they need to reevaluate. So as an outbreak goes, it's an emerging issue. It could be traveling across multiple states, or it could be well contained in a small area. And so as the situation evolves, that board would need to continue to gather information and continue to adjust their recommendations as needed if a situation evolves. So what the control plan actually is, or the response plan actually is a menu of potential responses. And of that menu, it could be anywhere from do nothing to recommend depopulation of a site to anything in between. And in addition to the menu, this was what we felt was very important, was that there needs to be an entity named to be in charge of that. So as an example, if one of the menu of options is we need to do more research, we would say that Pork Board has that mission to be in charge of research. That doesn't mean they do all the research themselves, but they may coordinate with USDA for USDA to do research. It could be other research that they would help support, but they would be in charge of getting research priorities developed and making sure that research gets done. We also needed to identify funding. In some cases, that's relatively easy on this menu of options. In others, it's going to be something we're going to have to look harder for. And obviously, it's all situation dependent. But we really felt unless there is somebody named in charge of each one of those menu options, that nobody's going to get it done because they're going to think that everybody else is going to do it. So who would we put on the U.S. Swine Health Board? We've already decided we need to rename it because the Swine Health Board is somewhat confusing name-wise with what you can hear from Dr. Sundberg next on the Health and Information Center. But we'd have pork producer leaders from Pork Board, NPPC, as well as ad hoc members. We'd have American Association of Swine Veterinarians members, members of USDA's veterinary services, state animal health officials, including if there is an outbreak, the state animal health official from the state where an outbreak would be held, as well as the state pork producers executive from that state, so that they really can give a boots-on-the-ground view. And then other experts such as diagnostic labs or others that would need to be brought in on an as-needed basis. So we've got some gaps and challenges to getting this implemented. One is that we need to have continue to do surveillance to uncover these emerging diseases in a timely fashion, and really know how to get that information looked at. And then we need a structure to support. The idea of the rapid response teams has worked well. We've had some that have been funded during the PED, but we don't have a formal entity that controls the rapid response teams and a formal process that they would go through during their investigation. So that's number one of some of the things we need to do. And then we are still having to get the functionality of the U.S. Swine Health Board. It's on a piece of paper. We know who's going to be on it. Those people haven't been named. There's not a staff person that's in charge of coordinating them. We don't have the communication channels put together yet where information is going to be fed to the U.S. Swine Health Board. So those are our challenges for this year, is how do we get that entity up and implemented and functional so that we're prepared for the next emerging disease. We also need to coordinate with our state and federal governments. In the last year, the USDA has proposed a rule called the National List of Reportable Animal Diseases, or NLRAD, and that would look at making emerging diseases reportable as well as changes in existing diseases. So things like increased mortality from current diseases that we have might become reportable. It was just a proposed rule. It's under, the comment period has closed and they're considering comments, but we need to figure out how we coordinate, and perhaps having reportable diseases actually helps bring information into the Swine Health Board so that that we can have that communication of here's what's out there, here's what's been reported. Do we think about what we should do about that? And USDA also has developed a framework for emerging diseases response. They are not contradictory, but we do need to lay them down side by side because there is not a Swine Health Board type concept within their plan. So the last thing, I think we're almost to the end of the presentation, is we learned a lot of lessons early on from PED, but I think we also need to close that circle and go back and evaluate the PED federal order. So in June 5th last year, PED became a reportable disease. There was USDA money put out to fund diagnostic testing, biosecurity, as well as some research. The money should run through the end of this year, and after that we need to evaluate whether the federal order is going to continue on in place, and then the money for those activities would come either from producers or other USDA line items, or should that order be rescinded because it's now an endemic disease. So we need to evaluate what was the value of that order. Was it valuable to producers? What about our trading partners? Did they count on that information? How did our state and federal governments use that information, and what was the value to them, as well as our customers and others. And so that's another thing we really got to work on this year, is to say, what can we learn from having put in place a federal order to require reporting, and can we do it better next time, or should we try something different next time? So, the things we'll be looking at is, were the objectives of that federal order met? And is there additional work needed that could be accomplished within the current federal order? And so, as we often talk about surveillance, you don't want to go looking until you know how you're going to respond. I would say in something like a program such as a federal order, we want to make sure that the beginning in itself has no value. It's the end which makes beginning meaningful. And we need to end what we have begun, because I don't think we probably want to go on and on and on without evaluating and deciding whether there is still value in the federal order. And so with that was a real quick run through. I really appreciate the vision of the forum delegates last year to address these issues, and you'll hear a little more in depth again about this on our Saturday session as far as the response to that delegate resolution.